Hello everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and after I co-founded SPT with Me, designed to help DPT students who are just about to take their NPTE actually understand content versus just trying to memorize everything. If you enjoy what you see, check out sptwithme.com for our 3 and 6 hour course. Now onto what you're actually here for, let's talk about normal gait. Throughout this presentation, and just bear with me, I'd like you to switch out the term normal gait with instead optimal gait. If you think about it, humans walk a lot, obviously, if we're able to. If we don't walk with an optimal gait pattern, mechanically, it's just not as energy efficient. We don't conserve enough energy. We can overstrain tissues and structures that ultimately lead to physical pain and impairments over the long run. So there's an optimal way of walking. To be able to have a normal or optimal gait, there are a few factors that need to be met. Number one, an individual must have the full range of motion that's required for each respective joint. If someone just had a total hip replacement just a couple weeks ago and they're not supposed to extend their hip past 0 degrees, are you really going to expect them to have a normal gait? No. Aside from the fact that they're probably in a lot of pain, you really shouldn't break precautions. So number one is having range. Number two is that an individual must have an MMT score of at least 3 out of 5 with all the respective muscles that are required to hold us up as we walk. 3 out of 5 is against gravity without any additional resistance. Now, if someone has a 2+ out of 5 strength, they might be able to walk still, but not optimally. Number three is coordination. Can your patient understand the concept of weight shifting? Do they have ataxia? Do they have proprioception deficits? Or is it actually in place so they can consistently keep their steps symmetrical and uniform relative to the last? And lastly, gait assessment is performed on level surfaces. So if you were to walk on an incline or a decline, you would look completely different. In this lecture, the main focus is to help make sense of not only gait, but the numbers that you're supposed to memorize. So there are 8 phases of the gait cycle. If you multiply 8 by each respective joint, so the hip, the knee, the ankle, so times 3, you're memorizing 24 different numbers. So let's just try to consolidate this information to make sense of it instead of taking the time for you to make 24 flashcards among everything else that you have to know for PT school. So let's keep it simple. The full range of motion that is required for each respective joint during our gait cycle includes the hip being between 20 degrees into extension and 25 degrees into flexion. The knee is between 0 to 60 degrees of flexion, and the ankle is between 10 degrees of dorsiflexion to 15 degrees of plantar flexion. Pelvic rotation, not depicted in this slide, that reaches between 0 and 5 degrees. So it just means that it moves at least a little bit. Now, before we continue, just note that as we talk about the gait cycle phases, we will have the right leg as the reference leg, and the left leg is the contralateral limb. Let's start off with initial contact leading into loading response. You should associate initial contact with the concept of the need for shock absorption. So try this out yourself. When you walk, notice that at heel strike, you flex the knee a bit. Now force yourself to land when your knee is straight. You should be able to feel that there's a lot of shock taking through every joint in your body. It's not only the ankle, but it's the knee, the hip, going all the way to the head. This shock is pretty uncomfortable, especially if you do it constantly with every single step that you take. Now remember, we're talking about optimal gait. You definitely don't want to torture your body by landing so hard every single time that you land with an extended knee. With that being done, it should make sense that upon initial contact going into loading response, we flex our knee from about 5 degrees to 15 degrees to dampen the force and take it through our muscles instead of our joints. Now, why 15 degrees instead of 10 degrees or 20 degrees? Well, again, it's about having optimal gait and efficient gait. If you're lunging and bending your knee 20 or even more degrees every single time that you take a step, that could be really tiring. At this point, you're practically doing a mini lunge every single step. And why anything less than 15 degrees? Well, that just might provide that much less shock absorption. Onto the hip joint. The hip is at 20 degrees for both initial and loading response. Now, why 20 degrees? Well, How could you possibly have one foot in front of the other if your hip is at 0 degrees? You can't. Now, why not 5 degrees or 10 degrees? Again, it's efficient, optimal gait. If you were to only flex 5 or 10 degrees, your cadence would need to be so fast to be able to keep up an efficient gait. So taking small but quick steps can be very exhausting. Now, on the other hand, why not 30 or 40 degrees? Again, energy conservation. If you're practically marching every single step that you take, that's probably exhausting. Next joint, the ankle. When you land in initial contact, your ankle is in a neutral position. It's not in plantar flexion, it's not in dorsiflexion, it's 0 degrees. Now, why not plantar flexion? Well, if you're in plantar flexion, you would be landing with either a forefoot contact or a flat foot contact. It's called heel strike for a reason, right? You're landing on your heel. So you know that your foot will not be plantar flexed. Now, why not dorsiflexion? So for this concept, I would love it if you could actually practice and do this with me. So stand up and balance on your left leg with your right leg hovering in the air. Now extend your right knee completely. Dorsiflex your ankle as hard as you possibly can. Just note how this feels. Okay, now relax the right leg, you're resetting. You're still balancing on that left leg though. Flex the right knee just a tad. Now, again, dorsiflex your right ankle. Note how this one feels. So between the two, which one makes dorsiflexion harder? The answer is when your knee is straight. Now, why is this? Your gastrocnemius muscle flexibility and the ability of your anterior tibialis muscle to contract against that flexibility. So the gastrocnemius attaches across the knee joint onto the femur, right? So when the knee is extended, the gastroc is tense. Now this is a very big girthy muscle. It is very difficult to contract against, meaning the anterior tibialis has to contract against it. So when the knee is flexed, the gastroc is now on slack. So we can get into dorsiflexion a little bit easier because there's less resistance. So what was the point of all that? Let's bring it back to initial contact. Now in this phase, our knee is extended. So there is tension from the gastrocnemius muscle. Thus, it is very hard to push our ankle into dorsiflexion. Now, could we? Of course. Why don't we? Optimal walking. Energy conservation. There is no need for extra work. All we need to do is just be able to clear the foot to make that next step. Now let's talk about mid stance. I mean, just look at the picture. It's pretty self-explanatory. The hip is in neutral, the knee is in neutral, ankle's in neutral. Now, why is that? Why don't we have any flexion in any of the joints? Well, why don't you go ahead and try in mid stance, flex the hip, flex the knee. I mean, do you really want to feel like you're squatting while you're walking? It's exhausting. Keep it simple. On to terminal stance. Here we are still in single limb stance. So the right leg is still on the floor. The contralateral limb, the left limb, is still in the air. Because the left leg is still in the air, we cannot just let the right leg go all limp all of a sudden. Otherwise, we're going to collapse. So the right limb is in 20 degrees of extension in the hip. This way, we can actually get the left limb as far forward relative to the right as possible. Our knee is at 5 degrees or pretty much neutral because we are trying to propel ourselves forward. Now, if our knee is flexed, this would be really taxing on the quads, which we don't need because why? Again, energy conservation. And now the ankle is at 10 degrees because we are propelling the body over the ankle. Pre-swing. Finally, the contralateral limb, the left limb, hits the floor and reaches its stance phase. Now, the right limb finally gets the opportunity to relax because the left limb that is now in stance phase can take over the heavy-duty job of bearing your body weight. So the right leg again can finally go limp, which is why we see the right knee flex, the hip begins to flex, and the ankle plantar flexes, which is how we can roll over the toe. So for the right leg, this is all at this point pretty much passive for the most part. We are not actively contracting any muscles at this phase to force these joints to bend. So still talking about the reference leg, the right limb, as we continue through swing phase, this is when we need to start contracting again. Otherwise, the right leg is just going to drag on the floor, right? I mean, if you think about floor clearance, it wouldn't make any sense for your knee to be extended during this phase because that's just cutting it way too close to scuff your foot across the floor. Your knee needs to be flexed. Well, why 60 degrees during initial swing? Said with a smile, energy conservation. What is the point of flexing your knee to 100 degrees and making the hamstring work hard, so much harder when just 60 degrees does the job? During the entirety of the swing phase, a lot of momentum is built up to essentially swing the limb forward. Now, this is really important as we talk about mid-swing going into terminal swing. In mid-swing, the limb is going full force into swinging to get that right leg in front of the left leg. You're whipping it forward. Now, all this momentum is going to get the hip to flex the most that it's ever been at during the gait cycle, which is at 25 degrees. And the hip is also going. It's going quickly from 25 degrees of flexion during mid-swing to an extended position in terminal swing. Now, going back to the hip, how come our hip flexion actually decreases 5 degrees between these two phases? The answer is the hamstrings. The job of the hamstrings is to extend the hip and flex the knee. That's its function. Now, if you didn't have the hamstring muscle to resist against this high momentum phase of the gait cycle, your leg would just continue to go forward and you would have a jerky, uncontrolled landing when you go into initial contact. Now, why wouldn't we want this? Optimal gait. If you were to whip that knee, it would be very uncomfortable. Plus, we also want to lead into optimizing shock absorption. The recruitment of the hamstring sets up terminal stance to go perfectly into initial contact, which you'll notice has the exact same joint degrees. The only difference between the two is that now with the right leg, instead of your leg being in the air in swing phase, it's now on the floor once again, and the cycle continues. We just did a whole revolution through the entire gait cycle. Did we go through every single angle at every single phase at every single joint throughout this presentation? No, we didn't. However, if you understand the process, the numbers are going to be easy to understand. As always, check out our references for more information. Hopefully this lecture cleared up some important pieces of information regarding normal gait. If you like this content, check out our 3 and 6 hour mini NPTE courses to help you figure out what you actually need to know for the exam.